Did you know that millions of people stop breathing hundreds of times every night without even realizing it? This is not just about loud snoring or feeling tired during the day. Sleep apnea can quietly damage your heart, brain, and overall health while you sleep. Have you ever felt extremely tired even after a full night's rest? That could be a serious warning sign you shouldn't ignore. What causes this dangerous condition? Can it be treated, or will it keep stealing your energy and health? In this video, we will break down everything you need to know about sleep apnea, from what causes it to the signs you must watch for and the treatments that can save your life. Understanding sleep apnea is the first step to protecting yourself and your loved ones from its hidden risks. What is sleep apnea? Sleep apnea is a disorder characterized by repeated pauses in breathing or shallow breaths during sleep. These pauses can last from a few seconds to over a minute and may occur dozens or even hundreds of times per night. Because breathing interruptions reduce oxygen levels in the blood, the brain briefly wakes the person to resume breathing, disrupting normal sleep patterns. There are three main types of sleep apnea: obstructive sleep apnea, OSA, central sleep apnea, CSA, and complex or mixed sleep apnea, which combines features of the first two. The most common form, obstructive sleep apnea, happens when the airway becomes partially or completely blocked, often due to relaxed throat muscles during sleep. Left untreated, sleep apnea can cause chronic sleep deprivation, leading to serious health risks such as high blood pressure, heart disease, stroke, diabetes, and impaired cognitive function. Recognizing the condition and seeking help early is vital for preventing these complications. Causes of sleep apnea. The leading cause of obstructive sleep apnea is the relaxation of throat muscles during sleep, which narrows or closes the airway. This blockage prevents air from flowing freely into the lungs, triggering the body's emergency response to wake briefly and reopen the airway. Several factors increase the risk of this airway collapse. Obesity is one of the most significant contributors because excess fat around the neck puts pressure on the airway, making it more likely to collapse. Anatomical features like a thick neck, large tonsils, a small jaw, or a deviated septum can also narrow the airway. Age and gender play roles too, with middle-aged men being most commonly affected, though women and children can also develop sleep apnea. Central sleep apnea has different origins, caused by a failure of the brain to send proper signals to the muscles that control breathing. This form often results from neurological conditions, heart failure, or stroke. Understanding the root cause helps guide the appropriate treatment approach. Symptoms of sleep apnea. One of the most recognizable symptoms of sleep apnea is loud, persistent snoring, often interrupted by choking or gasping sounds as breathing stops and restarts. However, not everyone who snores has sleep apnea, and some people with the condition do not snore at all, making diagnosis sometimes tricky. Other common signs include excessive daytime sleepiness, morning headaches, difficulty concentrating, irritability, and frequent nighttime urination. People with sleep apnea often wake up feeling unrefreshed despite spending enough time in bed, as their sleep cycles are continually interrupted. Because these symptoms can overlap with other conditions, many people go undiagnosed for years, increasing their risk of serious complications. If you or a loved one experiences these signs, especially loud snoring paired with gasping, it is important to seek medical evaluation. Diagnosis of sleep apnea. Diagnosing sleep apnea usually starts with a detailed medical history and physical examination. Doctors will ask about sleep habits, snoring, daytime sleepiness, and related symptoms. The examination often includes checking for physical features that may contribute to airway obstruction. The gold standard for diagnosis is a sleep study, known as polysomnography, conducted overnight in a sleep lab or sometimes at home with portable monitors. This test records brain waves, oxygen levels, heart rate, breathing patterns, and body movements to detect breathing interruptions and their severity. Based on the results, sleep apnea is classified as mild, moderate, or severe. Early and accurate diagnosis allows tailored treatment plans that can effectively manage symptoms and reduce health risks. Treatments for sleep apnea. Treatment depends on the severity of the condition and its underlying causes. For mild cases, lifestyle changes such as weight loss, quitting smoking, and avoiding alcohol or sedatives before bed may improve symptoms. Sleeping on one side instead of the back can also prevent airway collapse. Continuous positive airway pressure, CPAP therapy, remains the most common and effective treatment for moderate to severe obstructive sleep apnea. CPAP machines deliver a steady stream of air through a mask worn during sleep, keeping the airway open. While it may take time to get used to, CPAP can significantly improve sleep quality and reduce health risks. For those unable to tolerate CPAP, alternative options include oral appliances that reposition the jaw or tongue to keep the airway open, and surgical procedures to remove excess tissue or correct anatomical problems. In central sleep apnea, treatments focus on addressing the underlying neurological or heart condition, sometimes using advanced devices to regulate breathing. Lifestyle changes to support treatment. Treating sleep apnea isn't just about machines and medications. The way you live your daily life has a huge impact on your recovery. One of the most powerful steps is managing your weight. Even a small reduction in body fat can ease the pressure on your upper airway, making it easier to breathe while you sleep. Regular physical activity not only supports weight loss, but also strengthens your cardiovascular and respiratory systems, which are both affected by sleep apnea. And if you're still having the occasional drink before bed, it's time to rethink that. Alcohol and sedatives relax your throat muscles too much, making nighttime breathing even harder. Sleep quality is just as important as sleep quantity. A solid sleep routine, sleeping and waking at the same time every day, helps regulate your body's internal clock and can improve your sleep apnea symptoms over time. Simple tricks like raising your head with a wedge pillow can also reduce airway blockage during the night. And if you smoke, understand this. Smoking doesn't just harm your lungs, it inflames and swells your airways, making breathing at night even more difficult. Quitting can be hard, but it's one of the most important things you can do to help your sleep and overall health. Some people overlook other causes of airway obstruction like allergies or nasal congestion, but when your nose is blocked, you're forced to breathe through your mouth, which can worsen apnea. Treating these minor health issues can lead to major improvements in your sleep. These lifestyle changes, when added to your medical treatment plan, can help you breathe easier, sleep deeper, and wake up feeling alive again. It's not just about managing sleep apnea, it's about getting your life back, one healthy habit at a time. Complications of untreated sleep apnea. Ignoring sleep apnea can lead to serious health consequences. Interrupted sleep deprives the body of oxygen and prevents restorative rest, leading to excessive daytime fatigue and decreased cognitive function. This raises the risk of accidents, poor work performance, and reduced quality of life. Long-term untreated sleep apnea significantly increases the chance of developing high blood pressure, heart disease, stroke, type 2 diabetes, and even premature death. It can also worsen mental health conditions like depression and anxiety due to chronic sleep disruption. Sleep apnea can affect relationships and social life because loud snoring and daytime irritability strain interactions. Early diagnosis and treatment not only improve personal health but also positively impact family and social well-being. Sleep apnea may be silent at night, but its effects are loud during the day: tiredness, poor focus, and long-term health risks. The good news? With the right treatment and smart lifestyle changes, you can take control and breathe better again. You don't have to let this condition steal your energy or peace of mind. Your sleep matters, your health matters. If any signs feel familiar, don't wait. Get checked and start your journey to better nights and healthier days. If you or someone you know struggled with sleep apnea, share your story below. And if you found this video helpful, don't forget to like, subscribe, and turn on the bell for more powerful health tips every week.